Imagine a mother who has just delivered a healthy baby. Everything seems fine until she suddenly begins to bleed heavily. Within minutes, her life is in danger. Postpartum hemorrhage is one of the leading causes of maternal death worldwide. The good news is that with early recognition and prompt management, many of these deaths can be prevented. In this video, you'll learn what postpartum hemorrhage is, its causes, warning signs, treatment, and the essential nursing care every student and healthcare professionals should know. Postpartum hemorrhage, or PPH, is excessive bleeding after childbirth. Traditionally, it is defined as blood loss of 500 milliliters or more after a vaginal birth, or 1,000 milliliters or more after a cesarean birth. However, in practice, any amount of bleeding that causes signs of shock or instability should be treated as postpartum hemorrhage. PPH is classified into primary postpartum hemorrhage, which occurs within the first 24 hours after delivery, secondary postpartum hemorrhage, which occurs from 24 hours up to 12 weeks after birth. Now, what are the causes of PPH? The easiest way to remember the causes of postpartum hemorrhage is the 4Ts. Tone. This is uterine atony. The uterus fails to contract effectively after delivery. This is the most common cause of postpartum hemorrhage. Trauma. Injuries such as cervical tears, vaginal tears, uterine rupture, or episiotomy complications can cause severe bleeding. Tissue. Retained placental fragments prevent the uterus from contracting properly, leading to continued bleeding. Thrombin. Blood clotting disorders make it difficult for bleeding to stop. Remember, tone, trauma, tissue, and thrombed. Risk factors of PPH. Certain women have a higher risk of developing postpartum hemorrhage. These include prolonged labor, multiple pregnancy, polymyos, large baby, previous postpartum hemorrhage, induced labor, placenta previa, placental abruption, cesarean section, grand multiparity. However, remember that postpartum hemorrhage can also occur in women with no obvious risk factors. Signs and symptoms of PPH. The warning signs include heavy vaginal bleeding, passing large blood clots, a soft or boggy uterus, rapid pulse, low blood pressure, cold, clammy skin, pale appearance, dizziness, restlessness, confusion. If not treated immediately, postpartum hemorrhage can progress to hypovolemic shock. Management. Management begins immediately. Call for help. Assess the patient's airway, breathing, and circulation. Massage the uterus if uterine atony is suspected. Administer uterotonic medications as prescribed. Establish large bore intravenous access. Begin rapid fluid replacement. Prepare blood for transfusion if necessary. Monitor vital signs continuously. Identify and treat the underlying cause. Nursing responsibilities. Nurses play a vital role in saving lives. Monitor blood loss accurately. Assess uterine tone regularly. Monitor vital signs. Administer medications safely. Maintain IV fluids. Provide emotional reassurance to the mother and her family. Document all findings and interventions accurately. Communicate promptly with the healthcare team. Summary and call to action. Now let's recap. Postpartum hemorrhage is a life-threatening obstetric emergency. Remember the 4 T's. Tone, trauma, tissue, thrombin. Early recognition, rapid intervention, and effective teamwork save lives. If you found this lesson helpful, subscribe to NurseWise Academy for more nursing and midwifery lectures, clinical skills, and exam preparation videos. Thank you for watching and keep learning with confidence.